Opens. How do
Up where it says share. Oh yeah, that too.
present?
Mm-hmm.
Oop. All right, whenever you guys are ready. Can everybody see me?
Yeah.
Weird. Okay. All right. So fatal medication errors by Jennifer, me, Jessica, Sophie, and Vivian. Am I reading?
So I can read it. Our Sentinel event was a patient in the ICU is very sick after a myocardial infarction. The patient is placed on a heparin drip, but the nurse incorrectly calculates the dose, giving the patient 3 times the regular dose. It likely would have been caught had she performed the required check with an additional nurse prior to starting the drip. The patient begins to hemorrhage and passes away.
The 6 rights of medication: always have calculations double checked and verified for this specific reason. Right patient, right medication, right dose, right time, right route, right documentation.
What is heparin? Heparin is used for patients to prevent blood clots from forming. Blood clots can be and are dangerous to patients. It is used to stop the formation and thinning the blood to help prevent those blood clots. Heparin, under the classification of anticoagulants, is AKA is a blood thinner. So heparin is a black box warning of hemorrhage, hematuria, thrombocytopenia, and anemia. Like mentioned before, it is a blood thinner because it prevents clotting. This is also used to prevent DVTs, PEs, so pulmonary embolisms, MIs, which are myocardial infarctions. Open heart surgery is used after that, clotting syndrome, so if they have extra clotting factors, and then atrial fibrillation. There's normal doses of an IV bolus of 10,000 units. And then from that, it goes from 5,000 to 10,000, depending on the doctor's orders. And there's other routes that you can do it as well. You can have it continuously IV or subcutaneous. The contraindications that you need to be watching for is obviously bleeding and hypersensitivity to the product. If they're having any kind of side effects, it's going to be fever, chills, headaches, hematuria, hemorrhaging anemia, and thrombocytopenia. Heparin-induced thrombocytopenia, which is known as HIT. And then, of course, drug interactions. You want to be careful with those, especially those over-the-counter, such as ginger and ginkgo, green tea, and chestnuts. And of course, pool labs should be watched over and avoid any over-the-counter medications that would also cause any bleeding. And soft bristled toothbrushes, medical ID bracelet is a must, and any side effects need to be reported to your doctor immediately. These are the blood values that you should try to have and these will ensure that you have the correct dose and the correct route for your condition.
The heparin rationale. The rationale for the use of heparin therapy as an adjunct to thrombolytic treatment of acute myocardial infarction, or even to patients who spontaneously lyse a clot, is to prevent thrombosis of the coronary artery during the recovery period.
Signs and symptoms of heparin overdose. If you take too much heparin, you could have dangerous levels of it in your body, which could lead to serious bleeding. This can be deadly. Symptoms of an overdose include bruising easily, unexpected bleeding or bleeding that lasts a long time, such as unusual bleeding from gums, frequent nosebleeds, and in women, periods heavier than normal. Pink or brown urine, dark tarry stools may be a sign of bleeding in the stomach. Severe bleeding or bleeding you can't stop, coughing up blood or blood clots, vomit that contains blood or looks like coffee grounds, headaches, weakness, and dizziness.
The primary cause of injury/error was the patient received an incorrect amount of medication. The calculation was not completed. So patient was given 3 times the dosage, which caused the patient to hemorrhage and lead to death. So the prevention that we want is to ensure correction entry of the prescription, confirm that the prescription is correct and complete, beware of look-alike, sound-alike drugs, be careful with zeros and abbreviation, thoroughly check the order, triple check, and have a second verification with a licensed personnel with using heparin, and reduce distraction when possible.
So fatal medication error statistics. Medical errors are the 3rd leading cause of death after heart disease and cancer. Analyzing medical death rate over an 8-year period at Johns Hopkins, the patient safety experts have calculated that more than 250,000 deaths per year are due to medical errors in the US. Recent studies of medical errors have estimated errors may account for as many as 251,000 deaths annually in the United States, making medical errors the 3rd leading cause of death. Errors rates are significantly higher in the US than in other developed countries such as Canada, Australia, New Zealand, and Germany and the United Kingdom. At the same time, less than 10% of medical errors are reported. And for myocardial infarction statistics, approximately every 40 seconds, an American will have a myocardial infarction. The average age of the first myocardial infarction is 65.6 years old for men and 72 years old for women. And cardiovascular disease remains the leading cause of death in the United States, responsible for 840,768 deaths, about 635,260 cardiac in 2016.
And there's our references.
Yeah, heparin is one of the most, it's easily killed, can kill somebody. Any drug of this type, any drug that you take can kill you, but if you take enough of it, but heparin is one of those severe cases of that. Heparin, it has a black box warning stating that it can cause death if overdosed. This is an anticoagulation drug, meaning your blood is thinned out and does not clot. Too much of this drug and you will bleed out. This is what happened to our patient. This is our nurse in this scenario did not follow the second nurse check. A second nurse check is exactly what it sounds like. It is when a second nurse does a double check on the order versus the amount drawn to ensure the proper dosage. With heparin, this is a must. Orders are black and white, but yet we forget that we're human at times. As many times as we give a medication, as nurses fall into a routine, forgetting the 6 rights, we tell ourselves that we have given this patient's heparin 1,000 times before, and I know what I'm doing. But then the day comes when you find that you did not perform the correct protocol and find yourself at the center of a big mistake. This mistake happens when you least expect it. A 1,000 bolus of heparin and you gave 10,000, all you did was add a 0. But that's the difference between life and death for this patient. If our nurse would have stopped, double checked her own work, and then had another nurse confirm the dosage, the patient may still be alive.